Now, the news for South Mississippi. WLOX News this week.
Millions of dollars in federal money set to begin flowing into Mississippi. How the state plans to use that. And will school go back in session this year? The governor set to make a decision by Tuesday. And on the front lines, the medical battle against COVID-19 in South Mississippi, Jackson County, a hot spot. Hi, thanks for joining us. I'm Dave Elliott. We start with that, and here to talk about what's happening, Singing River Health System's Chief Medical Officer, Dr. Randy Roth. Dr. Roth, thanks so much for joining us. And as I want to tell all of the viewers, in the interest of full disclosure, we taped this on Friday. Everybody is seeing it Sunday morning. It's a very fluid situation, so things may have changed during the course of the last 48 hours. Dr. Roth, an emerging story this week, and you participated in a press conference at Singing River with the Jackson County NAACP, is that it appears as if the African American community statistically is disproportionately vulnerable to this virus. Medically, scientifically, what is your take on that?
This virus is colorblind. It's blind to socioeconomic status. The bottom line is our great African American population in Moss Point has risk factors and comorbidities like hypertension and diabetes and COPD. And that puts them at a higher risk. That's the first point. The second point is Moss Point's a very close community. They go to school together, they work together, they pray together, they gather together, and that's how this disease is spread. So myself and Lee Bond are working hard to show that community we love them, but the best way to show them that we love them is to tell them to isolate and quarantine, separate for a while, and let's get this curve to flatten. It is way out of proportion. 6 or 7 out of our 8 or 9 deaths have been African Americans. They've all had comorbidities like end-stage renal disease or dialysis or hypertension. But that's what this virus preys on. Tiger Woods is not going to get this disease, and if he does get it, I don't think he's going to be very sick. It's the folks that have very little reserve capacity that really get sick with this.
Well, let's roll with that thought for a moment, because and this is happening around the world, not just in South Mississippi. In terms of morbidity, the common denominator in all this appears to be underlying medical conditions, compromised immune systems. That could be everything from what to what?
So anything from a little bit of hypertension, morbid obesity, sleep apnea, COPD, coronary disease, or if you're a cancer patient getting chemotherapy, if you're a rheumatoid arthritis patient who's on Humira on a biologic agent, all those folks' immune systems are just beat down a little bit. And this virus that is very, very subtle and easygoing in a lot of healthy people wreaks havoc on that patient population.
Social distancing, avoiding large gatherings, washing hands, don't touch face. On the surface, to the average person, that seems so simple. But I think it's important every time we have you or any other doctor on to stress how important those measures are.
Hand washing at least every hour, or anytime you touch your face or sneeze or touch a loved one, which you shouldn't be doing. Hand washing is imperative. Distancing, especially this Easter weekend. Pray independently. God's on our side with this. Easter egg hunts, things like that, they need to stop. Family gatherings, you should only be with the people that you're quarantined with now. People think they're not going to get this from their cousin or their sister or their brother that they haven't seen in 2 weeks. That's exactly what we're seeing. Is little vectors in small church groups or families that have 3 or 4 brothers and sisters all with this illness. Separate, stay 6 feet away, wash your hands frequently, don't touch your face, don't share knives, spoons, cups, glasses, cans. And I think we got a chance to flatten the curve, but we got to kick it in now.
And we hear so much about the curve. We hear so much about the peak. There's so much uncertainty. Is it 2 weeks? Is it 8 weeks? Is it 4 weeks? The fact is, according to the models, and there are so many models out there, according to what's happened in South Korea or what's happened in Italy or what's happening in New York City or New Orleans, would you say it's safe to say nobody really knows when all of that is going to occur?
I think all these are projections. I do think our cases have slowed down a little bit in terms of patients being sick enough to be admitted to the hospital. But as we test more and it becomes a more efficient test to run, we're going to have more positives. There's no doubt in my mind. To me, I think our peak's 7 to 9 days away. We tend to be about 8 days behind New Orleans. My colleagues in New Orleans, who I talk to every day at Oshner, they have seen a little bit of a plateau. And through the grace of God, I hope that continues. Those people have really gotten hammered by this virus. So we're not plateaued yet, but we're hoping it's going to be soon.
All righty. Personal protective equipment. I don't think America ever heard anything about a PPE until the last 3 weeks. Face masks, gowns, all the other things that our health professionals need. Are you confident? Are you concerned at Singing River, Mississippi in general, that our hospital systems are covered?
I can speak for Singing River. I think we are well covered. I don't think we have a plethora or overabundance of it right now. But I think if our numbers stay the same, I think we can protect all of our employees and our medical staff for several more days as new shipments come in. We have learned a lot through this battle. We have reused certain PPEs, we've reused some N95s. You use the word fluid. The rules have changed 5 times in the last month that we've been dealing with this. So our infection prevention people are doing a great job of outfitting us, and we're preserving it. We've done some very interesting novel ideas, like put video monitors in patients' rooms where we can monitor their well-being without having to gown and glove and use PPEs on low-risk patients. Not only does that save PPEs when we need them, like in a code situation, but it also saves our employees another exposure. And I'm real proud of the effort that we've done, both in our ER and on our COVID floors with that technology.
In the early days of this pandemic, the federal guidelines were against the general public wearing face masks. We've seen a 180 on that. A pretty strict about face. Should people be wearing face masks when they go to the grocery store, when they go anywhere, basically?
If I was 65 or older and I had any comorbidities and I left my house and I had a mask, I'd wear it. Whether there's true data behind it from the WHO, I can't say that there is. But it certainly makes sense generically that if you're high risk and you're going to put yourself in an uncontrolled environment where someone may walk up to you unknown to you and get in your private space, whether it be at Walmart or Lowe's, it just makes sense to do that. So I have no problem with that. Our employees are given masks to wear in patient contact areas now, which we were not doing just 2 weeks ago. So this topic has changed, especially as our cases have grown and heated up.
All righty. The antimalarial drug hydroxychloroquine has become a political football. Let's face it, over the last 4 or 5 days, last week or so. What are your thoughts on that drug? Or any treatments that are associated with it?
The best treatment for this disease is not to get it. Do not expose yourself. Don't get it. Right now, our recommendations, which we kind of mirror our fellows at Oshner at University of Alabama, Birmingham, is if you're sick enough to be in the hospital, you have an abnormal chest x-ray, your oxygen levels are low, you have comorbidities, we are using a 5-day treatment regimen of Plaquenil and Zithromax, and we're dosing it appropriately. If you're just what we call a walking well, you've tested positive, your sibling, your brother, your significant other has tested positive, and you're asymptomatic, we're not recommending treatment. These drugs have side effects. Plaquenil is not a benign drug. We've used it for years for rheumatoid arthritis and other rheumatologic situations, as well as with malaria. But it can cause some heart abnormalities and rhythm. It can cause angioedema. So we're trying to be careful that we use it on the right set of patients, A, to protect them, and B, to protect the resources that we have to make sure we have it in the patients that need it.
All righty. I wish we had more time. Dr. Randy Roth with Singing River Health Systems, thanks so much for being with us, okay?
Thank you.